November is National Hospice and Palliative Care Month. In this week's Aging in Place, a nurse explains the difference between the two and how both can help patients and their families navigate a difficult time. A loved one gets the dreaded diagnosis of a serious illness. What often comes next for families is a choice between palliative care or hospice.
Many of them do end up going palliative first, just because they still don't want to think that they're giving up.
You might wonder how the two differ. According to health experts, hospice care is for those not expected to recover from their condition. It's to help ease pain and help families prepare for the end of life. Palliative care also eases pain, but it provides help if the patient's illness is serious but not life-threatening. Both offer flexibility. Power says patients can leave palliative care anytime, and they can move in and out of hospice care as needed. She adds hospice Medicare benefits cover those costs.
So anything you need for comfort or quality of life, medications, equipment, supplies, a nurse, a social worker, a chaplain, volunteers, bath aides, all of that is provided under the benefit.
She says it's beneficial for the patient and the family not to delay entering a relationship with hospice.
Give it a try. And like again, if it doesn't work out for you, you can leave, but it can really, really help the client dealing with everything that's going on, as well as the family.
Powers understands the benefits of hospice as a medical professional and also as a family member after her own mother entered hospice care last year.
I actually had to use hospice last year for my mother, and it was amazing to be able to bring her home.
Yeah, it provides so much comfort. Now, you'll find some helpful links about both hospice and palliative care on our website. I will get this posted for you a little bit later this morning. Yeah. And Daniel, hospice offers so much for families, like respite benefit for caregivers, just allowing them to, take a break for a few days. It also follows up with a family during their time of bereavement. Yeah. And, she's saying that the earlier that, families do get involved with hospice, the better, so you can take full advantage.
And I think just the earlier you can plan before you get into that situation, because then emotions can come into play. So just try to plan as early. No one wants to think about this, but plan as early as you can.
It's a very loving thing to do for the family.